Good afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama's College of Nursing, and this is my urinary indwelling catheter video. So the first thing that I'm going to want to do is verify my order and verify my hospital's policy. And then I'm going to perform hand hygiene and verify that this is my patient using two identifiers. So Jaguar Jones, MR number 4176352, MR number 4176352. I'm going to assess the allergies on the chart, so that says penicillin, and the allergies on the wristband says penicillin. And I would just get the patient to tell me if they had any other allergies that I need to know about. Then I'm going to explain the procedure to the patient to relieve any anxiety. And I'm going to look at my chart to see the justification for why we are giving an indwelling catheter. So 3 reasons would be required immobilization for surgery, trauma, or other therapy, a strict urinary output monitoring as indicated by the plan of care, and to assist in healing of open sacral or perineal wound in incontinent patients. So that's 3 reasons why we would give an indwelling catheter. And then I would provide privacy by closing a curtain or a door to make sure that the patient is comfortable. Then I'm going to gather my equipment, which I've already done. I'm going to don my goggles, position my trash can, and perform hand hygiene. Then I'm going to raise my bed to a working height for myself and lower the side rail, and I'm going to position the patient in dorsal recumbent position with legs slightly bent so that there is room for the sterile kit and sterile drape. Then I'm going to perform perineal care, so I perform hand hygiene and don clean gloves. And to do female, I would use soap and water, clean the inside of the thighs. I would clean the labia majora from front to back on one side, and then use a different washcloth or a different part of the washcloth and do the other side. And then I'm going to spread the labia, and I'm going to, with a clean swipe, go from the pubis to the rectum. And I'm going to make sure to clean all areas, so the clitoris, the labias, and the vaginal orifice. And if I move to a different spot, I would use a different portion of the rag. Then I would pat dry. For male, I'm going to grab the shaft. I'm going to also clean the inner thighs. I'm going to clean the glans penis from the urethral meatus in circular motions going back. And I'm going to do that until it's clean, and every time I repeat that step, I would use a different washcloth. Then I would clean the shaft down to the scrotum, and I would make sure to clean all areas very thoroughly, and then I would pat it dry. And perineal care is important because it makes sure that the area is not contaminated before insertion of the catheter. So then I'm going to get my catheter kit. I'm going to place it in between the patient's legs. I'm going to use the outer package as a trash can and place it on the bed near the patient's hip. I'm going to open up my package away from me. I'm going to open up out and then towards me, making sure only to touch the 1-inch border. Then I'm going to don sterile gloves. So I'm just going to move my computer so that you can see me donning my sterile gloves correctly. So I'm going to get my package. I'm going to perform hand hygiene. Sorry, the light, very bad. Perform hand hygiene. I'm going to open my package, making sure only to touch the outside. I'm going to put on my dominant hand first, so up and away from me. Then my non-dominant hand, grabbing underneath the cuff, and put it on up and away from me, and then fix my fingers. And then I can begin. So I'm about to break sterility by moving my computer, but you have to see what I'm doing. So I'm going to move my computer back to to where it was so you can see well. Then I'm going to pick up my sterile drape, and I'm going to place it between the patient's legs with the shiny part down. I'm going to make sure that's close to the perineal area and make sure that I do not contaminate my gloves. I'm going to make sure there's no gap between the sterile kit and the sterile drape, and make sure there's no gap between the perineal area and the bed. I'm going to take my plastic container. I'm going to place it on the sterile field, and I'm going to get my supplies ready on here. So I'm going to open up my cleansing supplies and place them on the plastic. I'm going to get my lubricant. I'm going to place it in the lubricant spot. I'm going to connect my 10 milliliter water-filled syringe to the balloon port. And mine hasn't been wanting to stay, so I might have to do something about that. Then I'm going to move my box closer, and I'm going to remove the plastic piece from the catheter, and I'm going to lubricate. So I'm going to lubricate the first 1 to 2 inches for female and the first 5 to 7 inches for male. I'm going to leave that in the plastic, and then I'm going to do my cleaning. So I'm going to move my box closer, and I'm going to, with my non-dominant hand, spread the labia, and I'm going to clean around the urethral opening. So away from me first, from front to back, closest to me next, and then down the middle. So if I had a male, I would grab the penis, and I would clean the glans penis, and I would start the urethral meatus and go in circular motions back and make sure that it's clean. I do it 3 times with my swabs. Now I'm going to tell the patient, I'm going to move my box, and I'm going to tell the patient that I'm about to begin. So I'm going to need them to, I'm about to insert, so I need them to bear down as if voiding, or take a deep breath and exhale on insertion. So to insert, I'm going to grab my catheter with my dominant hand. I'm going to insert until I get urine return. Once I get urine return, for female, I'm going to insert 1 to 2 more inches, and for male, I'm going to insert all the way to the bifurcation. Then with my non-dominant hand, I'm going to hold that in place, and I'm going to inflate my balloon. And like I said earlier, my syringe is not wanting to stay, but I'm going to put it on. And I'm going to inflate my balloon all the way, making sure to keep pressure on the plunger the entire time, and making sure to hold my catheter in place so that it does not dislodge, because if it dislodged, I would have to start over. Then I would remove my syringe from the balloon port, and I would normally throw it away, but I need it for another part of the procedure because it's the only one I have. So I'm just going to place it to the side. Then I'm going to gently tug until I feel resistance for where the balloon is, and then slightly insert. Advance it a little more. So now that it's in, I can remove my hands, and I'm going to show you how to use the stat lock. So to use the stat lock, you're going to skin prep however the instructions tell you to. You're going to place it on the patient's inner thigh. You're going to remove it kind of like you would a Band-Aid, and stick it on the patient's inner thigh. You would open it up, and there's a little up arrow to show you which way is up on here. With it on the patient's thigh, you're going to insert the bifurcation area into the clip. And you're going to clip it closed. So once you have it clipped closed and it's stuck on the patient's leg, you are going to make sure that there is slack. If there's not slack, that will cause trauma or tension on the urethra, and we do not want that. So that is the reason that we put it in the inside of the patient's thigh, clip it, and make sure that there is slack. So if the patient moves, then there's no tension on, no trauma come to the urethra. And to remove, you're going to use alcohol to remove the stat lock from the patient, and you're going to just press the button and unclip it. So that's how you use a stat lock and why we use it. So now that I've done that, I'm going to show you how to take a sterile specimen collection and how to have your bag. So I'm going to move my computer. So let's say that it is stuck to the patient's leg with the stat lock. I'm going to get my bag, and I'm going to place it below the patient's bladder, hanging on the bed frame, and not the bed rail, the bed frame. So it's going to be below the patient's bladder, and it's going to be hung on the bed frame. So then, to take a specimen collection from the bag, we're going to get our container. I'm going to move my phone so that you can see everything I'm doing right. So you have it below the patient's bladder, hanging on the bed frame. To get it from the bag, this is going to be considered clean after you have just inserted. So if you want to get a specimen collection right after you've inserted, you're going to get it from the bag. So you're going to open your container with the top up. You're going to remove this from the bag. You're going to make sure that this is above the container. You're going to make sure not to touch because that will break sterility. You're going to flip it open until the container is filled. You're going to flip it closed, still making sure not to touch. You're going to insert it back into the bag. And then close your container. And you're going to fill out the label so you know who it's for, when it was done, and what you're using it for. So now let's say that you need to get a specimen collection from the collection port after the catheter has been inserted for a few days. So you're going to use this little area right here. You're going to open your container, top up. You're going to get an alcohol pad, and you're going to clean off the area where you will inject the needle to withdraw the urine. So you're going to use a syringe with a needle on it, which I don't have, but you would use a syringe with a needle on it for this, and you would remove the urine. You can put that back down. And to put it into your container, you're going to make sure not to touch. You're going to insert it slowly so that you don't spill. And you're going to put your top back on. And you're going to unclamp your tubing. I forgot to say that I would clamp the tube before I started, before I removed, but I would clamp the tubing before I removed the urine and then unclamp it once I finished. So now I am pretty much done, and I'm going to remove all my supplies and place it into the trash can. And I'm going to remove my sterile gloves. So we're going to go glove to glove, making sure not to touch my skin. So glove to glove and skin to skin. Then I'm going to perform hand hygiene. I'm going to place my bed back down in the low position with the side rail up. I'm going to make sure the call light is in reach, the patient is comfortable, and I'm going to make sure that all of their comfortable equipment is in reach. Then I'm going to perform hand hygiene, and I'm going to go document. So I'm going to document the size of the catheter, the amount, color, and consistency of the urine, how the patient reacted to the procedure, and if I took a specimen collection or not. I would also describe my perineal care, so for the catheter care, daily catheter care, and after incontinence of stool. So it's basic with soap and water. I would just basically do perineal care, but I would make sure to put no tension on the catheter, and just thoroughly clean around where the catheter is inserted. And then I would plan to have the catheter removed as soon as medically indicated. So now I'm going to show you how to discontinue the catheter. So to discontinue the catheter, I'm going to use aseptic techniques. So I'm going to come back in the room. I'm going to perform hand hygiene. I'm going to put on clean gloves. And I'm going to don my goggles, which I already have on. So I'm going to don my goggles. And then I'm going to explain to you how you would empty your drainage bag. So what we used earlier to remove the specimen collection is what we would use. So I'd put that into a graduated cylinder. I would just make sure all of it comes out. I would put it in the graduated cylinder and measure how much urine I got. So then I'm going to loosen my plunger. I'm going to pull it back 1/2 milliliter. I'm going to connect it to my drainage port, to my balloon port, and I'm going to remove the water from the balloon with gravity. So once I get my 10 milliliters back, I'm going to remove the catheter. I'm going to perform perineal care, and I'm going to remove my gloves, perform hand hygiene, and I'm going to go document. So I'm going to document the color, the amount, the consistency, and the odor of the urine. I'm going to document the intactness of the catheter tip, how the patient tolerated the procedure, how much water I got back from my balloon, and how much urine I measured. And I would document teaching the patient UTI symptoms. So some symptoms would be fever, chills, flank pain, back pain, or frequency and urgency to urinate. So I would teach my patient those symptoms, and then I would then I would come back, and I would plan to assess to see if the patient has voided in 4 to 6 hours. So if the patient has not voided in 4 to 6 hours, I would palpate the bladder, and I would get a bladder scan if I didn't feel anything on the bladder palpation. So that's all.